Hi guys, I'm Dr. Robert Purchase, orthopedic surgeon and football fanatic, here to give you my take on the injuries from week 2 of the NFL. And really, how do we not start with RG3? On a fluke play, RG3 is rolling to his right, plants on his left leg, and dislocates his ankle. At least that's what we were told. If you look at this still photo, that to me looks more like a subtalar dislocation. Now, an MRI is obtained to make sure there aren't any other fractures. We don't generally get MRIs to look at ankle injuries, but we do get MRIs to look at foot injuries like a subtalar dislocation. Now, a subtalar dislocation is a pretty devastating injury. If you look at this prototypical x-ray, this is a subtalar dislocation where basically the remainder of the foot is dislocated from underneath the bone called the talus. Now, in an injury like RG3's where there aren't other fractures, the treatment may be as simple as a cast for 6 weeks. But once the cast comes off, then you got to do physical therapy to get your range of motion and strength back. I'm sure that won't take very long. Now, the good news is long-term results are generally good. Sure, your foot might be a little stiff. You might have a little difficulty walking on uneven ground. But a running quarterback in the NFL, I'm sure he will have no trouble getting back to his game. But what is clear to me is Washington Redskin fans, you better buy yourself a Kirk Cousins jersey. Staying with ankle injuries, Arthur Jones, defensive end for the Colts, he sustained a high ankle sprain just prior to the Eagles coming back for their big Monday night win. E-N-G-L-E-S, Eagles! Now, let's face it, unless you're a Colts fan, the fact that Arthur Jones is out for 2 to 4 weeks really isn't all that important. I present Arthur Jones' case because of this high-speed video clearly demonstrating the injury of a high ankle sprain. A high ankle sprain is different than the typical ankle sprain where the foot rolls in, stretching the ligaments on the outside part of the ankle. In a high ankle sprain, the foot is externally rotating, tearing or shredding the syndesmotic ligaments. These syndesmotic ligaments, they connect the small bone on the outside part of the ankle, the fibula, to the shin bone, the tibia. If they're stretched a little bit, they may heal in no time. If they're ripped, you're going to need surgery. Sounds like Mr. Jones just stretched his, so he'll be back in about 4 weeks. Let's finish with Knowshon Moreno. On the very first carry of the game, he dislocates his elbow. Again, high-speed video clearly captures the mechanism of injury here with elbow dislocations. With his arm planted on the ground, another player inadvertently lands on the outside of his elbow, applying a valgus force to his extended elbow, essentially shredding the ligaments on the inside part of his elbow. The bad news, that's the bad news. The good news is once you pop that thing back in, it's generally pretty stable. And I would expect Knowshon Moreno is going to be back in action in about 4 weeks. While I might expect him to be wearing a big bulky brace that may limit his ability to catch passes out of the backfield, I bet you he's going to be relatively good to go. Well, there you have it. I'm Dr. Robert Purchase, and that's my take on some of the more cringeworthy injuries from the NFL week number 2. See you next week.